All right, so today I'm joined by Josiah Harrell. How are you, man?
Good. How are you?
I'm doing great, man. And just to kind of give it a preface of the interview, you have come out of your Moyamoya surgery, planning on making a full recovery. How you doing? I guess coming off of that surgery.
Good. I mean, anyone I think that is going into a surgery, let alone a major surgery like a brain surgery, they're going to have anxiety going into it, and then also trying to figure out afterwards if you're going to be the same person, if you're going to be able to compete and do everything that you would want to do afterwards. So I'm doing as good as I can. Still have the anxiety of maybe the doctor saying no for me coming back. I don't think that's the case, but that's just how my brain works.
Okay. So a little bit of anxiety still coming out of it, but do you feel a little bit better at least knowing that you kind of made it out of that surgery? Like that must have almost been unbearable before that.
Um, yeah,
That's how
I
I
mean,
would take it at least.
it wasn't unbearable. If God doesn't want me to fight again, then that's His choice. But I would be sad. I would be broken. Getting into surgery or out of surgery, I think the biggest part was it was a relief that at least I won't die at 40, 45. But if me trading that life for the life of a fighter is the thing. I don't know if I think I'd rather just be like, cool, let me live as long as I can, be able to do what I want to do, my purpose, and I think fighting is what I'm born to do. I think that I would much rather have that and die at 40 than to not be able to fight again. So that's like it's the balance I'm at. I'm in and out of being okay with if that was were to happen. I don't think it is, but I'm trying to make it all make sense in my head. But there is a lot going on, and the only thing I can do is just go with the flow, I guess.
Yeah, so they said that before the surgery, you would probably live till max 45 if nothing had gone wrong, meaning no concussions and stuff like that in the meantime. Because for those that don't know, if you had gotten concussed, they're saying something could have happened right then and there, right?
Right. So concussed. I mean, really anything that messes with your blood flow. So drinking, working out, anything that puts me to sleep. But yeah, so the Moyamoya disease is it slowly over time makes it closes off the pathway. So my right side of my neck, my carotid artery, is closing off, and eventually it gets to a point where my body tries to keep up with it. So it starts making these extra pathways throughout the brain, which are really really brittle and aren't very good usually. And over time, everything starts to diminish on this side, and eventually I won't have any blood flow. And then if you know anything about seizures or strokes, those really have to do with the blood flow. And then usually, to get back to the point, usually around late 40s is when people um, get found dead or already had seizures or two strokes. That's when they're usually found, because this is a rare brain disease, and not a lot of people just get MRIs for the heck of it.
Yeah. Wow. So yeah, so it would have just progressed until you're 40 and you would have basically your organs or whatever you call it, your nerves or something like that would have just like capped out. Like it can't get any
Right.
bigger. It just would have like filled up completely. That's crazy that that would have happened to you. But I mean, the fact that the UFC does the medicals and you guys get all those MRIs, that's one of the positive things because even be surprised that some of that stuff doesn't pop up more for other people. You're like one of the only people that that's ever really popped up for. Like you never hear this happening.
Mm-hmm.
Like not even for tumors or like things like that, really.
Right. I think the dopest thing about what happened to me getting caught, I believe LFA now requires you to have an MRI before you fight. So it's like all their promotions are getting to a point where they want to be able to compete with the people. I mean, I doubt it's going to happen, but they're still trying and doing their part. So I think it's dope that LFA's increased their um, awareness around it, and now they require an MRI before
That's a good
uh,
point.
yeah, before fighting.
And then as far as when you kind of mentioned how you were debating, like sounds like you were debating not going undergoing surgery and just continuing your fighting career. Is that almost what you were saying? Like that
No,
was a thought of yours or no?
if I had a choice,
Okay.
and the risk, there I didn't have a choice. I mean, I guess I would have could have went overseas, but I don't know how they do that. So that could have happened, but no, in my head, I'm like thinking, I'm always like worst case scenario. So I'm like, if I were to have a choice between being able to live to 45 and not pursue any sort of passion or purpose in my life, compared to being able to live to about 30 to 40 doing what I love and what I think I can be able to do to help others, and actually have a purpose and be able to serve, I would rather live in a purpose and live a short life than to live a long life full of emptiness in a way.
Right. And that would have almost happened if you didn't get the surgery, right? Because then you got to probably avoid fighting,
Yeah,
which is what
I would
you
probably
love.
avoid fighting. I would avoid family. I'm not gonna force anyone to have my child and then me be like, cool, see ya. Yeah. So it would be, I would, yeah, I would just do what I can for others. But yeah, I wouldn't have a family. I wouldn't have much.
And so now, almost having that surgery is giving you more of a life purpose, right? Because you can live out your purpose.
Right.
Because if you're
Absolutely.
feeling like you're gonna like something was gonna happen to you, like you're just saying, you would have avoided starting a family and these kinds of things.
Right.
Yeah.
Yeah.